What's one suggestion or advice you have for primary care physicians or non-psychiatrists to follow so they don't miss diagnoses or they refer people at the right time? What are you seeing getting missed the most, and what should we look out for?
Yeah, so I think the most important thing, it's not so much the diagnosis being missed, it's the complicated, not like treatment resistant
Mhm.
people that when you're trying to primary care is trying to treat and they don't know what to do with the medications, or they're just like doing what they think they should do. I think that's the point where you want to definitely right look and go see a psychiatrist, because a
Yeah.
lot of the times meds are tried and that whole formula that's written on a book is not
Yeah.
exactly correct.
Yeah.
You want an expert to at that point. If you started somebody on Prozac and it didn't work out, send them to an expert after that instead of trying another drug yourself.
Yeah, yeah, because the only couple of things we know as internists is maybe Zoloft, Lexapro, Paxil, but that's pretty much all we do. But I've seen people like switching them around
Mhm.
without getting a psychiatrist on board. You don't think if one medication is not working, probably a good
Yeah.
time to send person to a psychiatrist.
Yeah, because I've had some patients, and most physicians are really honestly, they do a good job of managing it. Primary care has some experience, but sometimes it will get tough and they won't recognize that this is getting out of hand. And I think
Yeah,
that's
yeah,
obviously we probably need our family physicians in primary care to rotate more through psychiatry during their
yeah,
training and ER doctors, but
yeah,
that is like a completely different topic of systems.
yeah.